Hi everyone, I'm Dr. Shauna Dingman, and today I'm going to show you my absolute favorite exercises if you have neck pain, headaches, migraines, or just that feeling of chronic stiffness, especially if you're someone who works a lot at a computer or if you spend a lot of time staring down at a device. So here's what happens. The small part of the problem, which I know is a big deal for you, is the pain and the stiffness that comes from it. So when we're sitting for long periods of time, what we're doing is we're actually stressing our postural muscles. And the postural muscles are those muscles that go from the very base of the skull all the way down to the mid part of the back. And when we sit for any length of time, really more than 5 or 10 minutes in any one position, we begin to really stress those muscles out. So you can imagine if you work in an office at a computer, for example, or you sit for long periods of time driving, or if you're like my 14-year-old daughter who spends, it seems, hours on end staring down at a phone like this, our bodies were not designed for that, and it puts unusual stress, and the result of that is that you get a lot of pain, headaches, stiffness, that chronic pain you feel across the shoulders. And that's important. It's important that we figure out how to get rid of that. But the big picture that's happening is that when you do that over long periods of time, over many years, you actually change the structure and the physiology of your spine. And because your nervous system, your spinal cord is housed within your spine, when you begin to change the structure and musculature around your spine, you're actually putting pressure on the spinal cord and your nervous system, and your brain and body can't communicate the way they were designed to any longer. And that's why you have that collateral damage, which can be things like the headaches, the migraines, and the chronic pain and stiffness. So I'm going to show you a couple of really quick exercises that you can do within probably 3 minutes every single day that will help to not only get more mobility in the area, but will actually help to strengthen those muscles so that you can protect yourself from that change in structure. So in our office, we call this exercise yes, no, maybe, turkey, which sounds a bit strange, but when I do them, you'll understand why we call it that. And all you need is a piece of exercise band, resistance band, and this is just a tea towel that I've wrapped around. It just makes it a little more comfortable because I'm going to put pressure on it and use it on my neck. So what you're going to do is you're going to mobilize, so get your neck moving and strengthening in the 4 major planes of motion, which are up and down, side to side, head tilting, and what's called translation, which is that jaw jutting, sort of a sliding motion. We're going to work all 4 of those areas. So the first position that you're going to put your rubber band in is right at the very base of your neck. So look for that big knob that's right at the top of your upper back where it meets your neck. That's the first position. So you put your rubber band right there, and then what I want you to do is just put some resistance. It shouldn't be painful, but you should feel it tugging on your neck. I'm just going to back up a little so you can see my hands. They're actually right down here, and you can't even see my hands, but you can see that I'm pulling down. Okay, so what you're going to do is when your band is in that low position on your neck, your hands are going to be down low. So I have my hands right about my hip level. And then what you're going to do is 3 repetitions in each of the planes of motion. And a repetition would be up and down, or it would be side to side, or tilting side to side, or in the case of turkey, it's jutting back and forth. That's 1 repetition. You're going to do 3 repetitions in this position in each of the planes of motion, and I'll show you what that looks like. So yes, there's 1, 2, 3. We call it yes because it's like you're nodding your head yes. No is like I'm shaking my head no. There's 1, 2, and 3. Maybe. I don't know, maybe. That's 2 and 3. And then turkey, if you've ever seen a turkey in a farmyard, they kind of look like this as they walk along. 1, 2, 3. Okay, that's 1 position. The next position I want you to find with your band is right in the center of your neck. And when your band is in the center of your neck, your hands aren't going to be down, they're going to be straight out front. And you're going to do yes. There's 1, 2, 3, no, there's 1, 2, 3, maybe, 1, 2, 3, and turkey, 1, 2, 3. The last position, I want you to put that band right up underneath your skull. And if you just take your fingers and you feel right underneath your skull, you'll feel this bulk of muscle there. And I know for me, those are the muscles that get so tight and sore when I spend a long time working away at my laptop or my computer. And I find in most of my patients, those muscles are they've been so overworked that they're just in a chronic state of tightness. And you know what? I'll show you how to do it, and then I'll tell you what happens with your postural muscles after. So I want you to get that band right up underneath your skull, right in the bulk of that muscle, and our hands are gonna be up here. So I've got my arms out at about a 45-degree angle, and you're gonna go, yes, no, there's 1, 2, 3, maybe, 1, 2, 3, and turkey. 1, 2, 3. How far should you go? I want you to take your range of motion as far as you can into a pain-free range of motion. So you're not trying to force a motion that becomes painful. You want to take it as far as you can go without causing pain in each of the planes of motion. And what that's going to do is, what I didn't tell you before is when you are using those postural muscles excessively, they actually become stretched and weakened. So picture if you were chewing gum, you ever see your kids chew gum and then they take it and they kind of string it out and it's this like lazy string of gum? That's what happens with your postural muscles. So what I love about this exercise is not only are you getting motion into it, which feels so good when your muscles are stiff, but with the resistance, you're actually helping to strengthen those muscles and tighten them back up again into their normal form. And when you do that, it helps to release some of the pressure off the spinal cord that you're starting to get as that spine begins to shift and lose its structure. If you have any questions, put them in the comments below. I'll be monitoring the comments over the next 24 to 48 hours. If you happen to be watching this sometime in the future after that, just message me or email me at the office, Dr. Shauna at elevatewomenshealth.ca, and I hope that these are a huge help to you. Do them, I would say 4 to 5 days a week, 3 repetitions in each of the planes of motion and at each level, low, mid, high. I'll see you again soon.